Good evening, everyone. My name is Bisandit Kaur, and today I'm going to present Capstone Part 4 in front of you. Capstone Part 4 is a brief description of what I have done in previous three parts. So let's get started. Capstone Part 1 consists of a definition of hand hygiene, the topic which I chose. It is basically a procedure which is performed by health professionals in order to protect themselves from any kind of infection and other people, especially the patients. There are several reasons which may lead to poor hand hygiene in hospital settings, and one such a reason is their hectic schedule. Other than that, inadequate supplies of the sanitizers and other hand hygiene equipments, or if the equipments are broken. The nurses play a really important role in improving the hand hygiene, as they can conduct seminars to aware other nurses about its importance. Moreover, they can also encourage them to follow it effectively before and after touching patient or any other surface. Moreover, they can also keep a record of all the supplies which they have of the equipments. Either they are new, they are broken, or they are outdated. A research was conducted in Ontario at the time of COVID-19 in order to know what COVID-19 has an impact on hand hygiene, and the results were excellent and were positive. The results shows that after pandemic, people become more aware of the hand hygiene, and it was more prevalent in women as compared to men. So now I'm going to discuss the part two. The part two will describe the role of nurse in order to solve the hand hygiene issue by providing electronic hand hygiene monitoring system. It is basically an electronic device which has a band on it, and the nurses are advised to wear that band on their wrist, and whenever they are going near the patient, that band beeps if they have not done hand hygiene effectively. So, in order to know if this system is effective, an observational study was conducted in Canada, and the study shows that the system effectively works in the hospital setting, and the health professionals were also happy with the system as they have seen that now they were able to maintain hand hygiene more adequately as they were in past. So now I'm going to discuss about a change theory which is proposed by Lipid. This theory will basically discuss about the ways in which electronic hand hygiene monitoring system can be set up in the hospital setting. It includes few steps. So in the first step, the issue will be described, such as the issue was hand hygiene or the poor hand hygiene among healthcare professionals, and then it will discuss about the ways in which staffs will be motivated, such as by giving them any kind of reinforcement. After that, staff will be educated about the system by conducting various kind of seminars, and after the seminars, the feedback will be taken from them in the form of charts to know that how effectively they learn about the system. Last but not the least, a working plan will also be formed in order to make this system into practice in hospital setting. For that, in the first step, staff will be oriented about that what this device is all about. And then the seminars will be conducted in order to make them know how this device works, and they will be given a trial of the device. So, in the last step, they will be given reinforcement for being cooperative in this seminar, and will also be encouraged to give a feedback in the form of charts to know how much they have learned. Last but not the least, part three. Part three describes the outcomes which electronic hand hygiene monitoring system has brought up, and it is really surprising that the outcomes it brought was positive, as the incidence of infections among patients in the hospital has reduced to a greater extent. Now, I'm going to describe about the ways in which this system can be adopted in hospital setting. One such way is by upgrading the infrastructure of the hospital and by having enough budget to manage the expenses of the system. Furthermore, just like each and everything, this system also has some drawbacks. For example, if the company is not having enough budget, then they will not be able to run this system effectively in the hospital setting. Or if the nurses are not educated about how to operate this system. In order to maintain the sustainability of this system for the further 5 years, nurses are given education about the technology in detail so that at the time of using this system, they not feel hesitated that they are not able to use the technology or they're not aware of how to use it, and they feel really comfort with it. So in the last, I'm going to describe about the resources. In that, I have to add that in order to arrange the supplies, it is better to inform the higher authorities in advance so that they can arrange them before ending the supplies. So now I am going to share the references which I have used for my PowerPoint. So now here you can look that these are all the references that I have used. So thank you all for cooperating with me and have a great day ahead.